My name is Allison DeBecker, and this is my head-to-toe assessment video for Nursing 2050. We're going to pan the room. Knock, knock, knock. I'm going to wash my hands. Hi, my name's Allison, and I'm going to be your student nurse today. Can I just look at your wristband? Can you tell me your name?
Eva Stevens.
And can you tell me your birthday?
10/11/1993.
Okay, good. And are you in any pain right now?
No, I'm not.
Okay, and do you have any allergies?
No, I do not.
Patient appears stated age. There is no obvious signs of odor coming from her body or her mouth. There is no obvious illness noted. And can you please tell me your name again?
Eva Stevens.
And do you know where you are?
We were at my house.
And can you tell me the date?
Today is December 2nd.
Patient appears to be alert and oriented ×3. Okay, I'm just going to start by assessing your head. Patient's head is normal cephalic, so I'm going to feel for temperature. Temperature is warm, and her skin is dry to touch. Next, I am going to assess her eyes. Oh, there is also no obvious masses or lesions on her face. If you can just pick a point on the wall and stare at it. Patient's pupils are equally round and reactive to light. Next, can you please stare at this pen light? And her eyes also accommodate. I'm next going to assess her mouth. Can you please open your mouth? Her buccal mucosa is pink and moist. There are no obvious lesions or masses. Her tongue is also pink and moist. There are no missing teeth. All of her teeth are intact. Can you please stick out your tongue and say ah?
Ah.
Her uvula rises when she says ah, and her tonsils are grade 2, and her uvula is also midline. Okay, next I'm going to palpate her carotid artery. I'm going to palpate the other one. And her carotid arteries are 2+ bilaterally. Next I'm going to auscultate the arteries. Can you please take a deep breath in and blow it out and hold? And again. Okay, there were no bruits noted. I'm also going to look at your conjunctiva. Okay, they're pink and moist bilaterally. And I'm also going to assess for facial symmetry. Can you please raise your eyebrows? And can you please close your eyes? And blow up your cheeks? And smile. Okay, patient's face is symmetrical. Next, I'm going to assess her arms. Skin is warm and dry to touch. I'm going to palpate her brachial pulse. Okay, they're both 2+ bilaterally, and her radial pulse, which is also 2+ bilaterally. I'm going to check for capillary refill, which is 1 to 2 seconds on all of her fingers. And can you please squeeze my fingers? And patient's muscles are strong bilaterally. Okay, next I'm going to listen to your heart. I'm going to go to the right of the sternal border in the second intercostal space, which is the aortic. Next, I'm going to listen to the pulmonic, which is left of the intercostal space, left of the sternal border in the second intercostal space. I'm going to go left of the sternal border in the third intercostal space, which is the herbs. Going to go left of the sternal border in the fifth intercostal space, which is tricuspid. And fifth intercostal space, midclavicular line, which is the mitral. Their apical is also heard here, and your apical pulse can be heard for a minute if needed. Next, I am going to listen to her lung sounds. Each time I move my stethoscope, can you please take a deep breath in and out? Deep breath. Deep breath. Deep breath. Deep breath. Deep breath. breath. Deep breath. Deep breath. I'm going to assess the lateral lung sounds. Can you please take a deep breath? Deep breath. Deep breath. And another deep breath. Okay, her lung sounds are clear bilaterally. I'm going to have the patient turn around so you can see me assess her posterior lung sounds. Okay, if you can take deep breaths again every time I move my stethoscope. Deep breath. Deep breath. Deep breath. Okay, good. And I'm also going to assess the costovertebral angle. I'm going to hit it to see if there's any kidney pain. Can you please let me know if you feel pain?
No pain. No pain.
Okay, good. If I can have you turn to the side and lay down, please. I'm going to pull up your shirt. I'm going to inspect her skin. There is no obvious lesions or masses, and the skin is equal and hair is distributed equally. Okay, I'm going to auscultate for vowel sounds. And all 4 quadrants. Vowel sounds are present in all 4 quadrants. And if they weren't present, I would listen for 5 minutes before noting that. I'm next going to percuss. Okay, and I would hear a dull sound over organs and tympanic over hollow spaces. And I'm also going to palpate. Can you just let me know if you feel any pain? And do you need to go to the bathroom before I start? Okay. Did you feel any pain? Okay, and also the appendix is in the lower right quadrant, the liver is in the upper right quadrant, and the spleen is in the upper left quadrant. Okay. And if I can have you sit up. Okay, I'm going to feel your legs now. If I can just take off your socks. I'm going to feel for your popliteal pulse. Okay, I'm going to feel for your posterior tibial pulse, which is 2+ bilaterally, and the popliteal was also 2+ bilaterally. And I'm going to feel for your dorsalis pedis, which is also 2+ bilaterally. I'm going to check capillary refill. Okay, which is 1 to 2 seconds. Next, I'm going to have you stand up. If you can please bend over. I'm feeling for the spine. And there is no curvature, it's midline and straight. If I can have you stand up, please. Okay, and I'm just going to have the patient close their eyes and stand still for 20 seconds, which is the Romberg test, noting any swaying. There's no swaying, so the patient is negative for Romberg. If you can just do the get up and go test and take a walk. Okay? And can you please walk heel to toe? Okay, patient's gait is steady. And can I have you sit down again? I'm just going to note that there is no edema in her legs present. And can I have you lay down one more time? And I'm checking the contour, and it is flat. Okay, have you sit up? Thank you for letting me do a head-to-toe assessment video, and it's all done.
My name is Eva Stevens, and this is my head-to-toe assessment for Health Assessment 2050. Okay. Knock, knock. Hi, my name is Eva, and I'm going to be your student nurse for the day. I'm going to wash my hands. I'm going to check the patient's wristband for 2 forms of identification. What's your name?
Allison DeBecker,
And your date of birth?
3/20/93.
Very good. Do you have any allergies?
No.
Are you experiencing any pain?
No.
Okay. The patient does not appear to have any obvious illness or odor coming from her body or mouth. She appears her stated age, and do you know where you currently are?
Eva's house,
And do you know the day?
December 2nd.
And your name?
Allison DeBecker.
The patient is alert and oriented times 3. I'm going to start off by assessing the patient's head. The head appears to be symmetric and normal cephalic. Her skin appears to be warm and dry to the touch. Now I'm going to assess for facial symmetry. If you close your eyes real tightly and lift your eyebrows and smile real big and blow air into your cheeks. Patient tested positive for facial symmetry. And I'm going to assess the eyes. If you could stare at that point in the wall. The pupils are equally round and reactive to light bilaterally. Now I'm going to test for accommodation. Positive for accommodation. Now I'm going to check for the conjunctiva. Okay. Her conjunctiva is pink. Now I'm going to assess the mouth. You could open real big. Her buccal mucosa is moist, pink, and no obvious lesions. Her tongue is moist with no obvious lesions. Her teeth appear to be symmetric and intact. If you could stick out your tongue and say ah. Her uvula is midline. Appears to move upwards at the sound of ah. Can you open it up again? The patient does not have any tonsils, so 0 grade for tonsils. And I'm going to assess the neck. The neck appears to be symmetric. Now I'm going to palpate the carotid arteries. Okay, and I'm going to auscultate the carotid arteries to see if she tests positive for bruits. Now if you could take a deep breath in, exhale and hold it. Deep breath in, exhale and hold it. The patient tested negative for any bruits, and the neck does not appear to have any obvious lesions. Now I'm going to auscultate for heart sounds. I'm going to start off by auscultating second right intercostal space, aortic. This is right of the sternum. Left of the sternum, second intercostal space, pulmonic. Left of the sternum, third intercostal space, herbs. Left of the sternum, fifth intercostal space, tricuspid. Fifth intercostal space, midline, mitral. And at this point, you can also hear the apical pulse, and if you auscultate for 1 minute, you can hear it. And S2 can be heard the loudest at the aortic and pulmonic, and at herbs, they are both heard loudly, S1 and S2. And S1 can be heard loudest at the mitral and tricuspid. Now I'm going to listen for anterior lung sounds. Posterior. So if you can take a deep breath in. Deep breath. 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 I did not hear any obvious abnormal sounds, but you say that way.
Mm-hmm.
I'm going to test for any kidney pain at the costovertebral angle. Now, if you have any pain, just let me know.
Nope. No.
Okay, good. Now you can turn back around. I'm going to auscultate the lung sounds anteriorly. Deep breath. 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 I'm going to listen for lateral lung sounds. Deep breath. Deep breath. Deep breath. Deep breath. Okay, did not hear any abnormal lung sounds. Now I'm going to assess her upper extremities. Her skin appears to be warm and dry to touch. Capillary refill is less than 2 seconds. I'm going to assess the radial pulse, +2 bilaterally, brachial, +2 bilaterally. Now can you squeeze my fingers? Her muscle strength is good bilaterally. Now if you could turn to the side, I'm going to assess your abdomen. Okay. The patient does have a belly button ring. I'm going to auscultate each quadrant, starting with the lower right quadrant. But first, I'm going to assess, and the patient does not have any obvious skin lesions or abnormalities of the stomach or of the abdomen. I'm going to auscultate, starting with the lower right quadrant. A bowel sound was able to be heard in each quadrant. In the lower right quadrant, you would find the appendix. In the upper right quadrant, you would find the liver. And in the upper left quadrant, you would find the spleen. Now I'm going to percuss each quadrant. You would hear dull sounds over organs and tympanic over hollow spaces. Now I'm going to palpate for any tenderness. Do you have to use the bathroom?
No.
Okay. I'm going to palpate. Okay, there is no tenderness. All right, you can sit back up. Now I'm going to assess her lower extremities. Her skin appears to be warm to touch and dry. I'm going to feel for the popliteal pulse, +2 bilaterally, posterior tibial, +2 bilaterally. I'm going to remove this patient's socks. I'm going to feel for the patient's dorsalis pedis, +2 bilaterally. I'm going to check for capillary refill, less than 2. And the patient does not appear to have any edema. I'm going to check for the Babinski test. Okay. Now I'm going to perform the Romberg test. Can you please stand? I'm going to have the patient stand, and I'm going to be beside her to guide her. If you could close your eyes. The patient does not appear to be swaying in any way. She's going to stand here for 20 seconds. Okay, you did good. Now we're going to perform the get up and go. Now if you could walk this way. Okay, good. Now turn and walk heel to toe. Okay, good. Now if you could turn and bend over for me, please. The patient's spine appears to be midline with no abnormalities. Now if you could stand straight and then lay back down. I'm going to assess the patient's abdomen, which appears to be contour. And if you could sit back up, that would complete my head to toe assessment. Thank you.